How does compliance to treatment improve patient outcomes, patients who have chronic diseases?
Yes.
So first, it's important to understand what compliance means. So compliance is commitment to treatment, being committed to treatment, being committed to the goals that you set up together with your doctor. So if the doctor says you're supposed to take this medication at this time, then you have to stick to that schedule. So commitment to treatment is quite different from a patient just taking medication the first time. And this is very important, especially when it comes to chronic diseases, because normally in chronic illnesses like diabetes, hypertension, mental illnesses, these are diseases that can only be under control if the patient is on the medication for quite some time. Yeah, so the medication helps to improve symptoms and not necessarily cure the disease. So you find that most of these diseases are incurable, but the patient's quality of life can improve and a patient can live symptom free because of their commitment to treatment. So compliance improves outcomes in a way that you see these drugs have different effects in the body. Now, if a patient has been taking their medication for some time, it's highly likely that their symptoms would be controlled. If we look at depression, for example, mood disorder, where a patient is sad most of the time and they're given antidepressants. Now, these antidepressants help to improve the mood. So if the patient is on the medication for some time, then within the body, the drugs reach a particular level, and then the patient's mood is controlled. Then you see the patient is happy again and is now participating in the activities that they had lost interest in. Yeah, and then also same thing if we look at diabetes, for example, whereby in diabetes we have patients having uncontrollable sugar levels. So if a patient has been on the drugs for quite some time, then you have the sugar levels controlled.